Yes, there are several randomized controlled trials comparing CABG versus PCI in diabetes populations, namely the BARI study, the Syntax study, and the largest study to date is the Freedom study. All these studies showed that CABG is superior to PCI. However, in these studies, diabetes patients were not subgrouped into type 1 or type 2 diabetes patients. So since probably 90 or 95% of patients were type 2 diabetes patients, these results may not be generalizable to the type 1 diabetes patient population. So that's why we did the study. Yes, we used a number of national healthcare databases. The most important ones was the Sweetheart registry, where we retrieved the study population information about cardiac surgery, information about PCI, and the National Diabetes Register, where we have abundant information about diabetes, and outcomes were from the National Patient Register. So these were linked together and we used it for our analysis. So we included patients during 19 years of the study period, and it was from 1995 to 2013. And in total there were almost 700 patients who underwent multivessel revascularization with CABG, and 1,800 patients who underwent PCI with multivessel revascularization. And we did find that cardiac-specific mortality was higher in the PCI group, myocardial infarction was higher in the PCI group, and also repeat revascularization. However, all-cause mortality, there were no significant differences. However, the point estimate indicated that there was a higher risk in, however, not significant in the PCI group. The main limitation is what we call confounding by indication. So we are sure there were patients in the PCI group who were denied CABG because of things that we could not control for, so-called residual confounding. And this is the case in every observational study that compares two treatment strategies. You will run the risk of confounding by indication. However, I think that our study is the only way you can do a study in type 1 diabetes patients because they are so rare, and so it's a complement to prospective randomized controlled trials. There will never be a prospective randomized controlled trial in type 1 diabetes patients comparing CABG with PCI, so probably this is as good as it gets in terms of results in this question. And I think basically what we are showing is that you can actually take the recommendations, the current recommendations, and actually extend them to the type 1 diabetes population.